I was really impressed when I went to your website after Lucille asked me, and I put on the section that said previous speakers, and the first one that came up was Andrea Mitchell and the whole list, and I thought, wow, I'm impressed that they're asking me to speak. I also want to say one thing in the very beginning. I know Dr. Meadows is here, who's a doc, and I don't want you to think I'm going to be bashing physicians, but I will say one thing. She's in pediatrics, and if every person in the healthcare system could function as pediatricians do and people in neonatal intensive care at CHOP, we would not be talking about hospital-acquired infections because they are probably the most compliant group of docs, nurses, and healthcare people. You know, we often say to people, why do people in pediatrics so compliant? And they did some psychological studies on this, and they basically found out that pediatricians see these little kids as their whole future ahead of them. And when they're dealing with older people, and especially long-term care, we all know the problems there. They look at the quality of life and how many years left, and they've actually shown this. So we always say in infectious disease, you know, we need to model after pediatrics. So having said that, just a little background about myself. I am a true Philadelphian, stayed in this area, went to the University of Pennsylvania. My husband is Jack Guinan, who's here with me. We have 2 children who are also Penn grads, so we're a dedicated Penn family, and unfortunately my husband is a Villanovan, so will be home watching that game. So my background, as I said, was at the University of Pennsylvania. When I first started, after my undergraduate degree, was in medical technology, and I worked in the microbiology lab. And then went on and got my master's and doctorate degree in Penn in epidemiology, and I concentrated on healthcare education. I served on the faculty in the School of Medicine, and I was at the Leonard Davis Institute of Health Economics. And that was in the beginning of my career. When I went back after I did the motherhood scene, when I went back strictly as a researcher and specializing the last 15 years. I did leave Penn in 2008, but during the previous 15 years, I studied healthcare-acquired infections, and specifically not so much what we can teach to healthcare workers, but what we need to teach the consumers and people before they become patients. Because I often say once you become a patient, it's often too late. You know, you need to be armored on what you need to do to be empowered so that you don't become a victim of a hospital-acquired infection. So that's sort of in a nutshell what I've been involved in. I am on a World Health Organization committee and actually wrote the chapter for them on patient empowerment. And now I'm working with them because there's a campaign coming out May 5th of this year on how to teach the public and consumers about antibiotic-resistant organisms, which is a big problem. It's called the silent, epidemic. So that is basically my background, and in addition to that, I do have a book which you can look at over there, The Patient Survival Guide. I've been able to narrow it down to 8 solutions or 8 things that you can do or learn before you become a patient, not only in the hospital, but also outpatient, what you need to know about long-term care, assisted living, schools, daycare centers, and the workplace. So it's a gamut of what you need to do to prevent yourself from getting an infection. So in order to just get started, has anyone in here had a hospital-acquired infection or knows someone? Okay, so we have 4, and we have how many people here? That's probably about right, because we know that 5% of people who go into a hospital, and that's a conservative number, are going to get a healthcare-associated infection. Now, you notice I use the word healthcare because it doesn't have to be an inpatient setting. It can be a surgery center. It can be an outpatient clinic. They're still referred to as healthcare-associated infections. It's interesting, and you'll probably find this interesting, that in 1999, the Institute on Medicine came out with this report that said each year we have 100,000 people dying of medical errors. And if you recall, during that time, everyone was like appalled by this. Meanwhile, they were failing to realize that each year 1.7 million people get hospital-acquired infections. It's the 6th leading cause of death in the United States. More people die of hospital-acquired infections than breast and prostate cancer combined. More die of hospital-acquired infections than heart disease and diabetes. So you have to think of it this way. Every week, if 4 jumbo jets crashed, that's how many people are injured by hospital-acquired infections each week. So it's a monumental problem if you think about that, the number of people that get these infections. About 80 times each week in the US, patients undergoing surgery, there's an error in the operating room. And we know that most of these are preventable, to the point where we now have hospitals coming out with what we refer to as checklists. And they're very simple things in the operating room. The team has to have a timeout as a team and make sure that they've got the right patient, they mark the right side of the body, they have a backup plan, because not everything follows 1, 2, 3. You got to have plan B. They have the right blood that goes with the patient. Now, this may sound very logical, but there's so many flaws that can go wrong in this type of setting, because basically, you've got to get people to buy into this. Okay, we're going to have a timeout. You got to get everybody's attention. It's almost like running a nursery school. Okay, everyone listen, we're going to do this now. Let's make sure we do A, B, and C. And the other problem we have in the United States that we don't have in other countries is in the operating room, basically, it's the surgeon running the ship, okay? And he's going to do it this way. Surgeon B is going to do it that way. You go to the hospital down the street, they're going to do it a different way. Many countries abroad, if the Ministry of Health says, we are going to do this, every hospital does it the same way. And they've been able to use these checklists and have had some success. And we are not having the success that they are having abroad. So you have to think about that. Now, of course, when you're having surgery, you're not going to be there to be able to monitor this. But I'm going to tell you some things, and we talk about this a little in the book, but I'm going to go over some things that you should have your own checklist before you even get into the hospital. So we'll go over some of those things. Right now in the US, you've got about a 50% chance of getting proper care for what you're in the hospital for. Now that means proper care, meaning the hospital followed evidence-based guidelines. The hospital did what is appropriate for that condition. 50%, that's not very good. So what do we have to do? You have to take care of yourself, number one. The second thing is the best cure for this is to stay out of the hospital. We are so driven to go and seek medical care for everything. We do so many tests that are unnecessary. There's so many admissions now that we're trying to control this a little bit more, but it is definitely a problem. So you need to safeguard yourself. So I went back to, we talked about 100,000 lives in 1999. So here we are 15 years later. Have we done any better? Well, the answer is no. Right now, the data that just came out in 2013 shows that medical mistakes, okay, are about 210,000. Okay, so we've almost more than double. If we add to that all the other diagnostic errors and all the other failure to follow appropriate guidelines, it's about 440,000, okay, mistakes, of which a large number of these are preventable. And that's the key. They're preventable.